Hey, do you have sciatica? Are you wondering what things you should avoid? I'm going to tell you today the top 3 things to avoid if you've got a sciatica problem. My name's Dr. David Midoff. I'm an expert physical therapist and I'm the owner of Paso Manual Physical Therapy. We've been treating people with sciatica problems for a long time and they're always asking us, what should I not do to make my sciatica problem worse? So I'm going to share all 3 of those things with you today. Number 1, avoid stretching. Stretching is such a commonly done thing for sciatica. Many medical professionals tell people with sciatica to stretch. It's all over the internet. You go to YouTube, search stuff on Google, so many websites out there that recommend stretching for sciatica. Some of the most common stretches done is reaching down towards your toes, bringing your foot up towards your head, your knee up towards your head, and kind of a figure 4 type stretch where you pull your leg towards your chest. Those stretches usually tend to stretch out the butt area or the hamstring area, and they're very aggravating for sciatica issues. Now it doesn't always come off that way, and let me tell you how this is kind of counterintuitive. If you think about a situation where you ever hit your shin, where the front of your lower leg on the other side of your calf, you ever hit it on a concrete step or something banged it and it just hurts so much. And it might even bleed. And your reflexive reaction is to pick up your leg and put your hand on the area and rub it. And that is not making it heal any faster. You have to realize that it's not going to make the bump go away any faster. It's not going to heal the cut if you got it. It's not going to undo the scrape. All it's doing is tricking your brain from feeling the pain in that moment. The brain's amazing. It can be fooled so easily at the same time. If you rub your leg, think about this, it'll take away the pain from hitting your shin for a little while. It's kind of cool. Same thing is happening when you stretch though. If you've got a sciatica problem and you put yourself through a good stretch and you stretch out that area really well, it'll kind of take away the pain for a period of time. Doesn't solve the problem for the long term, but it'll reduce the pain or even take it away for a period of time. The problem is nerves hate 2 things. They hate stretching and they hate excessive pressure. So when you stretch, you're actually doing something that's aggravating to an already aggravated nerve. The trick is though that you make some of the other tissues in the area not feel the pain that you've been feeling. So my advice to sciatica people is avoid stretching. There's other things you can do to make sure that this sciatica problem gets better for the long term in a way that's natural and is helpful, not aggravating. The second thing to avoid is massage. Kind of like the stretching, it's counterintuitive. And let me explain. It's the same scenario. If you were to bump your shin, or let's use another example, if you bump your head on something and you start getting that bump and you rub it, right? And that kind of makes the symptoms feel better, makes the pain feel better for a little bit. If you go and rub your hamstring or your hip or your butt muscle, wherever the muscle's getting stiff and tight, because that happens with sciatica a lot of times, it'll kind of make the pain go away for a little while. And some people go to the extent of seeing a massage therapist to rub the area out super hard to make sure that they get some of the muscle relief. They'll buy tennis balls, racket balls, lacrosse balls, or rolling pin type devices, or they'll actually get a rolling pin and roll it out. And that can give some short-term relief, but if you've got a true irritated sciatic nerve and you're rubbing the heck out of that nerve area, it's only going to keep the symptoms there longer because nerves don't like to be aggressively rubbed. Let me give you an example of this. You ever hit your funny bone? The back of your elbow, the kind of inside of the elbow part, this area right here, it's actually a nerve that runs through there. It's called the ulnar nerve. If you bang it, if you give it some increased pressure, you'll send a jolt of pain, a zing sensation that goes into your hand, usually these fingers right here, because the nerve does not like extra pressure. And using the same example, some people, they have this numbness that comes on after they've been holding their phone up to their ear for a while. And that's because that same nerve, the ulnar nerve, the funny bone, gets stretched out over your elbow, and it can also set off the nerve symptoms as well. So avoid stretching and avoid massage. The third thing to avoid is lying flat on your back. Now, this is one of those things that's highly recommended by a lot of medical professionals out there. They'll say, don't lie on your side, don't lie on your stomach, and they'll say stomach's the worst, but lie on your back. And let me tell you why this is wrong. Now, if you're thinking about the things that I just said with the nerves not liking stretch and pressure, when you lie flat with your legs straight, it actually puts a low level of stretching through your nerves. You may not feel a bother in the moment, but if you stay like that for hours, as you might when you sleep, it's gonna set off some problem in the middle of the night. These people often wake up at 1 a.m., 2 a.m. with their legs cramping or numbness or tingling, intense pain going through their leg. And over time, the sciatica problem can get worse. So what I recommend is lying on your side with your knees and hips bent, kind of like the fetal position, like a halfway fetal position, with a pillow between your knees, ideally a thick pillow. Now, some people just have such severe sciatica that even lying on your side is going to be aggravating. You might try different sides, but if either side is just aggravating, you need to get some help, some professional help for that sciatica problem. So there you go, guys. The top 3 things to avoid: stretching, massage, lying flat on your back. If you've got a sciatica problem, you've got to avoid those 3 things to make sure that you get some natural resolution to your sciatica issue. Please explore our website to learn more about sciatica and other ways we help people stay healthy, active, and mobile while avoiding unnecessary surgeries, injections, and painkillers. If you're interested in hiring us to help you with your sciatica problem, please call us at 915-503-1314. Ask about our free discovery visit option for Facebook followers. If you're skeptical, uncertain, or worried that nobody can help you out with your sciatica problem, I get you, I completely understand. We hear this all the time, and it's very normal. Many people that have come to see us to treat their sciatica problem have been let down by other medical professionals out there. They've tried many, many things with little to no results, and I get that completely. I'd like to offer you my expert advice, all summed up in this guide though. If you're not sure we can help you out and you want to see what we have to say, kind of want to learn a little bit more, I encourage you to get this tips guide here. It's called the Top 10 Tips to End Annoying Sciatica Pain Using Natural Solutions to Avoid Having Unnecessary Surgery, Injections, and Painkillers. You can request this guide right now by finding the button around here and entering in your details there, and you'll get it instantly emailed to you. You can also call us at 915-503-1314 and request that we mail you a copy of our ebook here. If you're dealing with sciatica right now, please don't let it go on any longer than it should. Make sure you get some professional help to make sure this problem gets solved safely and quickly. I wish you the best of luck. Have a wonderful day.